Thank you so much to Dr. Hudson Nakamura for sitting down with me for that enlightening talk. Next up, we've got Dr. Ticiano Giobellina, who sat down with Matt Young to talk a little bit about the nature of education, especially of young doctors in Argentina. Take it away.
Hi, Ticiano. Thanks so much for taking the time to come on our program, Mice TV. I hope you're doing really well today.
Hi, Matt. How are you?
I understand Argentina is one of the regional economic powerhouses for ophthalmology, and I wanted to understand and help our Asia-Pacific audience understand, why is that? Why Argentina so strong in ophthalmology?
You know, here in Argentina, our private system, our private eye care system is very strong. We have a lot of big hospitals that people can go to the hospital and take the eye care for free. If they want to have a cataract surgery, they can have the cataract surgery for free. That's really good for people who do not have too much money to pay for the surgery.
That's great. And how many ophthalmologists are there in Argentina, would you say?
I think we are 5,000 ophthalmologists. In Argentina, I think ophthalmologist is a very subspecialty of the medicine. A lot of doctors want to do the ophthalmology residency because it's well known to be an ophthalmologist here in Argentina.
So let's start out with that. You know, I understand a common theme that we've been hearing time and time again in our conversations with other guests here on Mice TV is about training opportunities. So, you know, what would you say is the state of ophthalmology education and training in Argentina?
Our public system, we have a lot of opportunities for residents. And then we have a lot of opportunity of fellowships here in Argentina. For example, in my own clinic, we have residents from Uruguay, from Chile, from Ecuador, from Brazil. In Argentina, you can also have a lot of opportunities of fellowships. And also because here in Argentina, as you know, you can study medicine for free. So a lot of people are coming here to my city to study medicine because they do not have to pay.
That's amazing, and I feel like that's a great point for the Asia-Pacific community here because, you know, of course, many students would travel abroad for studying medicine to, say, North America, the United States, or in Europe, but maybe they're not thinking about a country like Argentina when they could be, perhaps, right?
You know that to study medicine, you have to study 6 years, and it's a lot of money. And then also, if you have a residency, if you apply and you are accepted in a residency, you are going to be paid for that, for your work. And that's good.
I'm also curious a little bit about your upcoming OphthalmoCordoba conference. Can you tell me a little bit more about what's happening there and why it's important for the region?
Our meeting is, as you know, is focused in cataract, cornea, and refractive surgery. This year, we are going to add a symposiums of glaucoma, oculoplastic, and young ophthalmologists. There are coming young ophthalmologists from all over Latin America. So we hope we have a good time there and we learn a lot with our colleagues.
One unique initiative that I heard about at your meeting, I believe it's called the Ophthalmo Forest Initiative. Can you tell me a little bit more about the Forest program?
As you know, here in Cordoba, this area of my country, we had a lot of fire. So we start thinking about doing something for helping our environment, our planet. This is the first ophthalmological forest in the world, and you can buy your tree there. So in OphthalmoCordoba, once a year, maybe in April or May, that is the better time to do the plantation of the trees. We do one plantation per year. The last one was last year, and the first one was last year. We planted about 400 trees there. A lot of new meetings like European meetings, and here also in Latin America, they are starting to think about the environment, and that's very nice. I think we can help our planet in our meetings, you know.
Another subject that I was interested to turn to is that of optometry, because I know in some places in Latin America, like Brazil, the profession is not legal, but how about in Argentina?
you know, here in Argentina, optometry is illegal. You know, yet we don't have optometry. Almost all the ophthalmologists do the work of the optometry. I don't know why optometry is not here. I don't know that. I don't know exactly why, but we work together with all the ophthalmologists here. We work very well. I think that in countries that have optometrists, they work together very well. We're in a observership in Colombia about 10 years ago, and they work with optometrists, and they need optometrists. They are very happy with optometrists.
And what do you think might be the future potential between Argentina or even Latin America as a whole and the Asia-Pacific region? For example, do you think that there are opportunities to learn from each other? And, you know, if so, why?
Learning is something that we don't have to stop. We have a lot of Italian and Spain immigration, so we always try to look to Europe. Also to North America, you know, that we are very near to North America, but Asia Pacific is a very big, we have to look about that. That's why I think we are starting to do some friendship with you. And I think that the potential that you have there is very, very big. I think it will be very good if we can enroll together and start working more together, you know.
That's wonderful. Well, we come to you with open arms. We're so glad you joined us here on MICE TV to tell us a little bit about Argentinian ophthalmology as well as ophthalmology around the region. Thank you so much for joining us, Ticiano, and all the best.